Women have borne the brunt of the pandemic. And now, for the first time, we've invited North America's leading practitioners in women's health to come together and share their insight into the challenges and opportunities of caring for women, families, and our communities this year. Well, welcome to Nutramedica and the Women's Health Masterclass. I see that we have a full house today, over 500 people attending today. It's wonderful to see our healing community come out to support this kind of high quality programming.
Thank you, Brian. Thank you very much. And thank you for all your instrumental support and direction in this event coming to fruition. You put in a heave-ho effort, and I really appreciate it. And thank you to NFH, the sponsor of this event, for their continued incredibly robust support of the naturopathic profession and giving us tools to help our patients. So let me introduce you to our panel, my friends and colleagues, Doctors Lisa Alschuler, Jaclyn Chasse, and Meghan Walker. Rather than read a little of each bio, I actually really invite you to check out each doctor's website to see just like a snippet of what they've been up to all these years and what they're up to now. It's really quite impressive. I invited these three colleagues in particular to participate in this panel because these three women are amongst the most ridiculously productive, smart, skillful, impactful, creative, and influential NDs of our time. They've made contributions to all of us and thus tens of thousands of our patients in the realms of naturopathic medical school education, postgraduate education, entrepreneurship, naturopathic and integrative medicine research and clinical practice, state and national policy for naturopathic medicine, business development, the natural products industry, and all the while having babies. Well, not Lisa and I, but raising children. And yes, even me the last 4 years, raising a child, having cancer and starting and maintaining their own businesses, relationships, and life. Basically, you three blow my mind in talent and generosity. Kind of chokes me up just saying that. And I sincerely thank you for being with me and us today. So Brian, what's our first topic today?
The first topic today, Tori, is I think we all understand very clearly that women have borne the brunt of the pandemic. And we want to talk about the challenges that women are facing now and the impact that it's having on their health.
I know we all have many patient experiences relative to the pandemic. And given we have lots of data showing us how women of all ages, races, employment, and socioeconomic classes have had to shoulder really special and unique burdens relevant to COVID. The question is, how have women in our practices been struggling this year? There are issues related to mental health, self-care, balance with childcare and home teaching, plus working outside the home, weight gain, increased alcohol use, delay of preventive medicine, exams and recommended tests, decline in birth rates and even risks during pregnancy with COVID, and violence against women in the home. I wanted to share with you that in one published survey, 51% of women and 34% of men felt that worry or stress related to the pandemic had some impact on their mental health. And 21%, like a fifth of them, reported that anxiety related to COVID had a major impact on their mental health. More women than men worry about themselves or a family member getting sick from COVID, and more women than men worry about losing income due to COVID. Women are also more likely to go without health care during the pandemic compared to men. And then there's the issue of the uninsured and less likely to seek COVID testing due to worry about cost. A larger share of women than men also say they have skipped preventive healthcare services or have skipped recommended tests or recommended treatment. And a larger share of Hispanic women cannot get an appointment and limited medication because of the pandemic. And as you can imagine, the list goes on and on. So for me, I know that I'm treating even more anxiety than usual and even more discussions about the importance of self-care in light of the children in virtual school at home, work from home, and just, plain old less time to no time for things like exercise. I'm also generally seeing about at the low end of 5-pound up to 20-pound weight gain in a significant number of women in the last year. So what was already a challenge is even more challenging. So Jaclyn, I was thinking about starting with you. What challenges are you seeing with women in your fertility practice this last year? And by the way, what's with the decline in birth rates?
I know. So actually, there's just been a couple of interesting articles that came out about that because they really expected a baby boom post-pandemic. Everyone was talking about that. We're on lockdown. There's nothing else to do. Why not, make
Have
it
more
fun,
sex? Yeah.
make it fun. And 9 months later, we expected to see a big boom. But in fact, they're calling it a baby bust because this is the sharpest decline we've had in birth rate in the United States since we've been tracking it. Last year, it was a 6% decline year over year in birth rate. Now, the year before that, there was a 4% decline. So part of this seems to be a general trend, but I think that extra 2% does factor into some of the things you've talked about, starting out here, that women are under an incredible amount of stress. And so there's the biological impacts of stress on our fertility, but then also that fear of uncertainty. And I think couples are consciously choosing to maybe not have a child when they're concerned about their job security or they're concerned about their health of their child, to be pregnant during COVID and, to give birth in a situation, go through a pregnancy where your partner can't come to the ultrasound and may not be able to be in the birthing room. I think there's a lot of kind of social impacts from the effect of the COVID, not the infect, like you said, that have really impacted that. And also last year, remember, like women were mid-cycle. They might have been injecting themselves with drugs when the fertility clinics shut down for months.
Oh, wow.
So there was, for my own practice, a ton of women coming in because they didn't want to wait and they wanted to see what they could do to try to get pregnant in the meantime. Interestingly, last night I had my first follow-up with a patient who had gotten pregnant January of 2020, delivered her baby during the pandemic, and now he's 4 to 6 months old and they're ready to start trying again. But it was interesting to talk to them and get their experience of being home with their baby 24 hours a day with no additional care, but both partners being home. And I think that's like kind of a plus. Her husband was working from home where he never would have before. So, there has been a lot of changes.
Yeah, this has been so difficult and painful to witness, actually. And I think it's showed up in some obvious ways and some less obvious ways. So the obvious ways are women definitely delayed screenings. And I've had more patients this year than ever before diagnosed, for example, with breast cancer at a later stage because they deferred their mammograms. That's especially an issue for women at high risk, women with a history of breast cancer who have had a patient not too long ago who had a distant history of breast cancer, found some lymph nodes, felt like it was probably recurrence, didn't want to go in and risk herself because, the psychology is that if this is cancer, my immune system is suppressed. The last thing I want to do is encounter this virus. And yet then that metastatic disease progressed. And so by the time she got it checked, it was much more advanced, I think, than it would have been, therefore more difficult to treat. I've had too many stories of that. The other way in which it's affected women is in their self-care. I had a patient not too long ago who I've been seeing for years, and she's actually recovered from breast cancer again. She's doing super well. She had some other issues that we've been managing, but basically her baseline health is really fantastic. And then all of a sudden, our last visit, her hemoglobin A1C was high, her fasting glucose was up, and I'm just like, what is going on? I've never seen this before. So it turns out during this pandemic, she dropped her exercise program significantly. She started ordering her groceries and wasn't happy with the kind of fruit and vegetables she was getting. So was eating a lot more processed foods. And it was literally changing her biochemistry in a way that infers risk for chronic disease and recurrence. So I think that's another element of this pandemic that I've seen too.
I hope you enjoyed that highlight from a recent program on Nutramedica. If you want to get access to our full-length shows and live interactive events, you'll need to register as a healthcare professional at Nutramedica.org. To stay up to date with our latest programs, go ahead and subscribe to this YouTube channel, and don't forget to hit that notification bell. We'll see you soon at Nutramedica.org.